Did you know that there are four major parts of Medicare? My name is Thea Luzuriaga, founder of Care Insurance Solutions. Because I care. I'm here today to help you understand Medicare so that you can make a very well informed and very well educated decision with your Medicare options. But first, let me give you a quick introduction about myself. My name again is Thea, that's Thea, and I have been a Medicare advocate for about 21 years now. I have my license in life and health nationwide. What that means is that I'm able to offer Medicare plans, whether it's a Medicare supplement, Medicare Advantage, or drug plans nationwide. And I'm also appointed and certified to offer different Medicare supplement insurance carriers. But like I said, let's begin in explaining the different parts of Medicare. There are four major parts of Medicare: A, B, C, and D. And yes, they are coded by letters. A and B are your original Medicare. A, like in Apple, are your hospital benefits, and B, like in baby, are your medical benefits. These are your federal, called original Medicare, because you've worked in the United States for at least 10 years or have paid into the system for at least 40 quarters. Medicare, by the way, are your benefits for people 65 years or older or under age 65 if you've been on Social Security disability for 2 years. So let's go back to A and B. A, like in Apple, covers inpatient hospital, skilled nursing facility, home health care, and hospice care. And those are the four benefits under your hospital part A. Most of you have paid into the system or have worked for at least 10 years or 40 quarters. So you are entitled to your hospital part A premium free. However, if you have not worked enough quarters, then in 2026, the standard part A hospital premium is $565 each month. And then if you were to go to a hospital as an inpatient, you're really not covered in full. This year, the standard Part A deductible is $1,736 per benefit period. A benefit period is defined as having been in a hospital and has not been transferred to another facility for 60 days in a row. If you stay in the hospital longer than 60 days, then on day 61, you will be billed a flat dollar copay amount of $434 each day. After 90 days, you pay a flat dollar copay amount of $868 per day. So there is no cap. There's no out-of-pocket maximum. Unlike if you're insured, there's a limit to how much you're going to spend. With just hospital part A, the bills can go on and on because there's no out-of-pocket maximum. That's your inpatient hospital. Part A is also for a skilled nursing facility. This is a very short-term rehab center. For example, where you go after surgery, you may be moving there for physical therapy. That's your skilled nursing facility. Medicare covers you up to 100 days. However, with just your original Part A, you pay nothing for the first 20 days. But if you stay longer than 20 days, then from days 21 through 100, you have a flat dollar copay of $217 per day. Part A is also for home health care, nothing custodial, only if it's medically necessary, and hospice care, end of life care. But those you are covered in full. So that's all that there is for Part A. Part B, as in baby, like I said, is anything medical. Your doctor's visits, your surgery, your emergency, your therapy, blood tests, MRI, CAT scan, dialysis, chemotherapy, ambulance, physical therapy, outpatient services, outpatient surgery. So those are your medical benefits, okay? Once you activate that, there will be a Part B premium for that. And the Part B premium is based, we're now into 2026, is based on your 2024 modified adjusted gross income. In 2025, the minimum Part B premium was $185 per month. In 2026, it has gone up to a minimum of $202.90 per month, up to about $689. Again, depending on your modified adjusted gross income. Okay. Now, if you have a life event, the good news is you can appeal to lower that Part B premium if your income when you're applying for Medicare is not the same as from 2 years ago. We can help you appeal that if there is a life event, for example, work stoppage, divorce, or loss of income producing property. You can absolutely appeal to lower your Part B premium. Also, you must know that for those of you folks who are still working at age 65, you can absolutely refuse Medicare under 3 conditions. For as long as you're actively employed, for as long as you work for a large employer defined by Medicare as having 20 or more employees, and able to maintain what's called a creditable coverage. Creditable coverage simply means that it pays equal or the same as Medicare. Okay? And however, when you're ready to retire in the future, regardless of age, even past the age of 65, it is also important to activate Medicare in a timely manner. Ideally, you would want to activate Medicare at least 60 days prior to the month off when you're losing that employer creditable coverage and 60 days after. Yes, you can pick up Cobra. However, Cobra can be very costly. Again, if you have any questions about this, my office or my agency is absolutely able to assist you in activating Part B at age 65 or in the future. So now we've covered your hospital Part A and medical Part B. Again, generally, all of you will have to pay your Part B medical premium. Other folks can get assistance for their Part B premium, whether it's through your state Medicaid program, the Medicare Savings Program, if you belong to a lower income bracket. And we can help you find assistance for those as well. So now we've established the fact that your original hospital Part A and medical Part B really does not cover you in full. But there's a solution, right? We don't want you to be exposed to the risks of what Medicare does not pay. So there are 2 types of coverage in the Medicare world if you no longer have an employer plan or any credible plan, okay? The 2 general options in picking up a plan are either Medicare Supplement or Medigap and a separate prescription drug plan, Part D plan. Let's talk about that. Medicare Supplement and Medigap are one and the same. These plans are designed to cover or to supplement or to cover the gaps of what original hospital Part A and B does not pay. So simply put, these are secondary to Medicare. With the Medigap plan, Medicare, keep in mind folks, Medicare is really the largest insurer nationwide, accepted by about 90 to 98% of medical and hospital providers nationwide. So with the Medigap plan, Medicare pays as primary, and the Medigap just covers the gap. These are not managed care plans. These plans will really give you the ultimate freedom, flexibility, and peace of mind. Why? Because these are not managed care plans. There are no rules. You don't really need to check if your providers accept the plan. I mean, you can for as long as they accept Medicare, but the fact that, again, Medicare is the largest insurer nationwide, you generally should not have no issues. So with the Medigap plan, Medicare will pay first, and a Medigap will just cover the rest of what Medicare does not pay. So no rules, no referrals, no prior authorization, no claim forms. It is very important to understand that in most states, okay, you only get one golden ticket, one entry in enrolling with a supplemental plan or a Medigap plan without having to go through medical questions, especially if you have a pre existing condition when you're new to Medicare. The only time that you can enroll without being screened for any pre existing conditions are either within 6 months of turning age 65 or within 6 months of becoming new to Medicare Part B, like in baby. Keep in mind, becoming new to Medicare Part B can either be at age 65 or later on down the road if you're choosing to continue to work. Okay. Outside of this 6 month open enrollment period, we call it, there will be medical underwriting down the road. And if you have a pre existing condition, unfortunately, it is going to be quite challenging to find a health insurance carrier that will provide insurance to you, except if you're in what's called guaranteed issue states. So some states do not require medical underwriting, for example, the states of New York, Connecticut, and Massachusetts. So that's your first option is a Medicare supplement or Medigap plan. Now, these plans are also coded by letters to make it a bit more confusing, right? The most popular Medicare supplement or Medigap plans are called Plan G like in George or N like in Nancy. Keep in mind, folks, these are plans, not parts. Plan G like in George or N like in Nancy will cover Medicare Parts A and Part B. Does that make sense? So, for example, Plan G will cover all of your Medicare approved medical and hospital services almost 100% after you've paid just a one time standard Medicare Part B medical deductible of $283 just once per calendar year. Now, Medicare supplement plans come with a cost, right? There is a monthly premium for any Medicare supplement plans. And that premium is on top of your Medicare Part B premium on top of a separate drug plan. So, for example, I am in Greenville, South Carolina, and the rates here for a 65-year-old female non smoker would probably run around 120, 130 per month. If a person picks up a Medicare supplement plan G to supplement Medicare Parts A and Part B, once that's been approved, that person will present two ID cards to any medical or hospital visits, which would be the Medicare ID, original Medicare A and B, and a Medicare supplement plan G. And she will be covered in full 100% after she has paid the first 283 deductible. But then again, she needs to figure out a separate prescription drug plan. While Medicare says you're not required to pick up a drug plan if you decide to pick it up later on, because you can't just enroll whenever you want to. There are certain enrollment periods and late enrollment penalties to avoid, right? So if you skip a drug plan and you pick it up later on, there could be late enrollment penalties down the road. So again, the first option is a supplement and a drug plan. Keep in mind, most Medicare supplement plans in most states are called standardized plans. Or let me take it back. Medicare supplement plans are standardized plans, which means that it's offered through private insurance carriers, but these carriers are really allowed to differ in rates. It is my job to shop around for the best possible rates for you offered to you by a nice, solid, stable company. Like I said, I've been doing this for 21 years. We have a beautiful software where I can research the stability of the company, the history of rate increases, etc. And even if your premiums increase as you age, I will continue and I'm committed to holding your hand in ensuring that you retain the same low rates that you originally got from for as long as you keep yourself healthy. So that's it. That's your first option is a supplement and a drug plan. If you have any questions, don't hesitate to give us a call. My name again is Thea at 864-625-2112. And again, we are trusted nationwide, not just in South Carolina. We are trusted in many states. So that is your first option. Let's talk about the second option. For those of you turning age 65 or new to Medicare, I'm sure you've been receiving lots of mailers, maybe TV ads with these type of plans. This is called a Medicare Advantage plan called the Part C, like in Charlie, that covers your A, hospital, B, medical, and D, prescriptions, all rolled into one plan called the Part C, like in Charlie. Medicare Advantage plans are now designed to cover your A, B, and D under one plan, like a regular insurance. These plans are your typical HMOs or PPOs. HMO stands for Health Maintenance Organization. PPO stands for Preferred Provider Organization. These plans take the place of Medicare. So just keep in mind, folks, both options, you need to maintain your original Medicare A and B. Both options, you need to keep on paying your Part B premium. So Medicare Advantage plans, if I have to go back, again, will cover medical, hospital, and prescription under one plan, like a regular insurance, probably similar to what most of you have today, right? But these plans will take the place of Medicare. You will not lose your Medicare benefits, but when you enroll with these plans, you only use one ID card to go to your doctor, specialists, hospitals, and pharmacy. The beauty about these plans is it's more affordable on a monthly basis. These are designed to have lower monthly premium plans. Some even have no premium plans, right? But these are managed or administered by private insurance carriers, which means almost the opposite of a supplement. With an Advantage plan, there are rules to follow, right? We need to make sure that you go to contracted providers, which means these are called in-network providers that do have a contract with a specific insurance carriers. If it's an HMO, chances are you would need referrals to go to another specialist. If it's a PPO, yes, you have in and out of network benefits, but if you go outside the network, you pay a higher copay. There are copays for every service. So, for example, it may be a $20 copay to your primary care doctor. It may be $40 to your specialist. It may be $300 a day up to 5 days if you go to the hospital. It may still be 20% of the contracted amount for chemotherapy, dialysis. So there are flat copays for every service that you use it for. But the beauty about these Medicare Advantage plans is that you now have a set limit called an out-of-pocket maximum. An out-of-pocket maximum can be a good thing. It's your protection. You don't have to spend all the way because most plans have an out-of-pocket maximum of maybe $7,000, $8,000, $9,000 for a calendar year. It does not mean you need to spend $9,000. It's not a deductible. Out of pocket maximum simply means that is the most that will ever have to come out of your pocket, just in case something catastrophic happens. For example, you may have received bills for over $100,000. Heaven forbid, you're protected by an out of pocket maximum. In both options, they're good insurance, right? But we don't know what's best for you. There are many factors that we need to consider, we need to look at. And by the way, I think I've skipped the drug plan. With a supplement plan, as I've mentioned earlier, you will need a separate drug plan. And it is also my job to help you as a complimentary service. If you're wanting to enroll with a supplement plan, I can help you enroll with a separate drug plan because you have to understand all these insurance carriers have different drug list or formulary. What that means are the drugs that they approve to cover. They have different set copay or percentage of how much you are responsible for each copay. So my job is to really shop around for you, make sure that you're put with the right plan because even a husband and wife have different circumstances, different medications, different everything. So with that said, if you have any questions, I hope you give us the opportunity to serve you. We have built our agency based on the service that we provide, the integrity, the honesty, and the friendship and trust that we've built with our clients. So please do not hesitate to give us a call if you have any questions. My name again is Thea from Med Eye Care because I truly care. And my direct line is 864-625-2112. You may also send us an email at admin@medicaretlc, tenderlovingcare.com, admin@medicaretlc.com. Our website is medicaretlc.com. You may also find us on Facebook or Google. Our Facebook page is Med-I-Care Insurance Solutions. Thank you so much, and I hope you've enjoyed this video, and I hope to hear from you. Have a great day and stay well. Thanks, guys. Thank you so much for your time, and I really hope that you've enjoyed this video. And if you did, please hit like and subscribe on the button below. Thank you so much, folks, and you all have a wonderful day. Bye now.